cart, just like our tanks, blue is nitrous, green is oxygen, and it's going to show you, because even here my O2 is green, my NO2 is blue. You have a little on this side, pushes in. See that?
Yep.
So you're going to push it over, and you're going to put it into the holes, and wiggle, and then let go. And that's going to clamp that there. And you can always kind of tug a little bit, make sure you're in. Then this is where my air is actually coming from here through here to here. So this, same thing. I got a little clicker thing right here.
Okay.
Right now. Just slide it over.
And that goes in that's for the vacuum.
Yes, and that's the back. Same thing, let go, clamps on, and I just double check.
Okay.
So for your nasal hood, obviously one-time use disposable. Open the plastic. I usually like to open the plastic when the patient's in the room just so they know that it's been sealed.
We used to wipe the noses off.
Mommy.
Is that disgusting? What?
Well, no, some are autoclavable. Some you can, or you put in cold sterile, but ours are disposable. So you've got a corresponding big hole, small hole on each side corresponds with this.
See the cut?
Make sure I got it right.
At the top. Look up.
Big hole goes in big hole, small hole goes in small hole, like that. And I like to wiggle it down. Sometimes if you just have it on there a little bit, they're going to start messing with their nose and the hood may pop off the hose.
Thank you.
So I put it in there, push it all the way in.
Okay.
So from here, once all this is hooked up, when I actually lay the patient back and I'm ready for air to flow through here, on our cart, this is our valve. So 0 means you're getting no airflow. You will not feel or hear air come through this nose. Okay. You will open it slightly. And that's when in your course they'll talk about these different numbers and things you have to gauge. You'll see your airflow right here. Typically, Allie says we keep it around a 5. Some patients, your airflow at 5 may be here. Some patients you do max. It all depends. So that's going to control how much actual airflow, not how much nitrous or oxygen you're getting, just the actual airflow
What's
itself.
coming through there,
Yes.
regardless of whatever that is. Okay.
So here is how we control our nitrous and our oxygen. So right here, NO2, this knob right here, will control it. On the side, I have what percent I'm at, 60, 50, 40, whatever.
And will that also correspond?
It will correspond, but I don't have tanks on, so I don't have airflow right now. So when
But we're pretending, right?
Yes. Okay. If I put that at 40%, my ball is going to come hover right around that 4.
Do we not have to flush first?
Not always, no. Oh, look, my oxygen made it
that's
move.
what I was like. I saw in the video like stuff about this bag and flushing it first.
So my oxygen is going to correspond with that. If you turn it on, you get it where you want it. You guys will all learn what numbers you start at, how to increase. So this knob controls how much oxygen I'm getting. This knob controls how much nitrous I'm
What number
getting.
do you normally do? Is there a normal?
I mean, I know the video, they started at 6, but then you're supposed to gauge, like, does the person feel like they're getting enough or too much, and how this bag goes?
I will tell you right now the way Adam and Allie have always done it, and the way I've done it for my patients. I turn it on oxygen, 100% pure oxygen.
Oh, all the way up.
For 30 seconds to a minute.
Okay.
I bring it back down to 60.
Okay.
I turn my nitrous up to 40, and I let them hover 60, 40.
Okay.
If it's a bigger adult, sometimes that you may want to go more. You don't ever want it. It's hard to tell because they'll tell you in your course you never want more than 70% of oxygen or of nitrous. But most people you hover around that 60, 40, or you turn that up just the slightest little smidgy, see how they feel.
And normally that's throughout the whole appointment.
Yeah,
And the oxygen normally stays at 6.
You know what?
Yeah, 60% oxygen,
Never
40%
increase that.
nitrous.
I will tell you, when I do a nitrous on a hygiene patient, which is what, twice a year maybe, I turn nitrous off when I am like flossing. They don't put it on for an exam.
Yes.
Turn that shit off so you can get them back.
I will do that in the doctor's room
yeah.
too. Like once the procedure's done,
Yes.
or I'm waiting on a doctor check, I turn that nitrous off. I kick that oxygen back up to 100%.
Yes.
That way, by the time the doctor comes in, checks me, the patient's already had that 100%
Yes.
pure oxygen for 3 to 5 minutes. They're done.
So you turn it back up to 10 after you take the nitrous.
Yes.
Okay.
Yeah. After this,
I gotcha.
in your course, like the videos and stuff will just show you this. This I mainly want everybody to feel comfortable hooking up the tank and knowing that this controls your airflow. This is controlling your actual nitrous and all that.
So do you all pay attention though to this bag?
A little bit, but not really. It's so far down under my chair. I don't.
Because
I've
I was
heard
like,
Dr.
I
Allen
don't,
like more with kids. and
Yes,
making
you
sure
can
they
tell if they're not.
inhale.
Yes.
Yeah, so they can
not
hold
really
the-
getting it. Yeah.
I don't hear it
Okay.
so much with adults. I just hear it with kids.
So I'm
And
gonna
making sure they breathe through their nose versus like their
Yes.
mouth. and
yes,
talking.
yes, and but they'll go through those sorts of specifics
Yeah.
with you guys. So I'm gonna unattach this. I will tell you.
So you just turn them down,
Yes.
Yep, turn them
and
off.
then you
Turn them off.
Yep, and you
turn
turn
that
your
off.
airflow off.
Okay.
Down
then-
to 0. Okay.
I push this and see how I had a little bit of air pressure.
Yes.
It's going to be pressurized, even though I have tanks off right now. So if it makes a loud-ish
loud.
noise,
done
that's
it
normal.
to me
It may
before.
scare you the first couple times, but. And I'm just deconnecting this so you guys can practice if you want.